For the introductions, I'll pass it on to Gaurav. Gaurav, if you want to make the introductions, please.
Yes, absolutely. I'll go over to the introductions with the first questions, but for the audience here, I just want to set the context of why we are talking about the business case for sports and healthy longevity. The quick background to that has a lot to do with the space, what I do for a living on a day-to-day basis. I co-founded this company called Activo Labs 7 years back, and our entire endeavor is to help people around the planet live healthier, happier lives. Now, why is this a statement? What is the problem statement that we're trying to address? And I'm going to set the context and I'll hand over to the experts in this space, is that I understand the macroeconomic problem statement 7 years back. One of the defining moments of me starting this journey as an entrepreneur in the space of healthy longevity was I was at a conference in 2015, and it was chaired by, the keynote speaker was Dr. Devi Shetty. It was in Chennai. It was a conference for the Congress of Surgeons. And his keynote to a room full of surgeons and me was around chronic diseases. And according to his research, this is back in 2015, according to his research, by 2030, he said that half of India's GDP would go towards the management of chronic conditions, right? And that, I was like, okay, half of India's GDP, and Modi ji just promised us a $5 trillion economy in a few years, right? And it looked like that's not a business, that's an industry that's going to happen. So something's going to happen right over there. And what was the challenge behind that is just simply a function of longevity. The last 100 years, all of the clinical R&D dollars have gone towards increasing the quantity of life vis-a-vis the quality of life, and I think that's where we are tackling this question. So I'm going to first go to Professor Richard. Richard's here. Richard, maybe a quick introduction, and then elaborate on healthy longevity. And my follow-up question to Dr. Stagna is that how do we do that before we go into the business side of things with you, Vijay? Yeah.
Great, thank you so much, Gaurav, and also Vijay for the kind invitation to join you at this conference. And certainly this morning I learnt a lot about sports and business and the cultural context as well. So by way of background, I head up the aging research at King's Consortium at King's College London. I'm also a visiting professor at the University of Oxford in medical sciences field. So I think it's really important that we properly define the word aging and longevity. Often misunderstood. There's a lot of hype around longevity, but how do we view this in the context of what Gaurav said, the economics of an aging population with comorbidities, these NCDs. And what we need to understand, first of all, is aging is not a disease. It's the passage of time. And I've discussed that with a number of you in the audience already. And we start to age on day one of conception, day one of life. In fact, your aging trajectory is determined by both maternal and paternal factors that are before you're conceived. And as we progress through time, we become, 9 months old and we're born. So aging is just a passage of time. And we need to consider also that first 9 months of the in utero environment. That also has a big impact on the next, hopefully 100 years of our lives. So that's aging. What is longevity? Okay, longevity is not living between 100 and 125 or beyond. It's not about taking supplements. It's the context of well-being as we age across the life course, across the lifespan. And you've probably heard of the word health span. How can we extend the health span? Reducing the risk of these age-related diseases, the multimorbidities, metabolic diseases, type 2 diabetes, all of which are prevalent not just in India but across the globe. And also, so reducing the risk, delaying the onset, reducing the severity is about prevention. And prevention is not, okay, what's the best supplement, the best lifestyle, and so on. And as Professor Vai said, it's also this cultural context of what is aging and longevity. The background of why we should maintain well-being is deeply rooted in our cultures as well. And we have a lot to learn from the Indian culture, the Chinese culture. So I have an interest in traditional Chinese medicine, Ayurveda, and so on, in the context of modern science, modern biosciences, drug discovery, and so on. We have a lot to learn. So maybe if I just leave it there, because I don't want to take up too long, and hand over to my colleague, Dr. Sagna.
Thanks, Richard. I could have said the exact same thing, obviously, because everything is obviously very important for this discussion, and you just asked me to elaborate on some potential interventions and
How do we live healthier?
how do we handle this now? And maybe to give you a bit more context, what we've seen in Western countries over the last 60 years, basically just after the Industrial Revolution, food has changed, the way people live has changed, social systems have changed, everything from very basic things such as how much physical activity we get on a daily basis to psychosocial factors. How do we live and treat each other? And we have seen the changes in Western countries, and for a very long time we have assumed, and many colleges and universities, high schools, still teach young people the idea that we are seeing an increase, a constant increase in life expectancy. That is assumed to be a given, and that has stopped. We are the first generations that are seeing a decline in life expectancy in Western countries, and that is due to chronic diseases. And we can't stop aging. There's a lot of business, obviously, around longevity, as Richard said, different longevity, anti-aging interventions. Aging is going to happen. The real question is, are you going to age healthy? And how do you prevent diseases? And since this is a sports conference, before we get to any other intervention, exercise really is the magic pill. If you look at the data are very, very clear that nothing comes even close to exercise and physical activity. You can take all these fads and trends, intermittent fasting, dietary supplements, all sorts of dietary interventions. Some of them are interesting, and sleep obviously is very interesting, certainly important, but the number one intervention to prevent this from happening, that is this cluster of chronic diseases, is living a healthy lifestyle. Now that sounds very simple, but it is actually very, very difficult to achieve. Because we've been trying for 50 years to implement something with the European Union, in other countries, the US, on a very high level, both Richard and I, getting people to exercise more, which seems like a very easy task, is actually extremely difficult. So it requires a cultural change, and I think the idea of business, sports, and culture as sort of a bigger picture to maybe motivate people to be physically more active, and then downstream have a healthier society, I think that's a very valuable proposition.
Professor Vijay, I think just to Dr. Sagner's point that getting the societies and incentivizing them to live, pick up exercise, sports is a great way to do exercise more regularly. Now, if we spoke a lot about countries getting developed, becoming richer economically, has a direct translating into more number of Olympic medals. The unique case is that of the United States, the richest country in the world, wins the Olympic, but 6 out of 10 adults are living with the chronic conditions, right? So the question, even more, okay, so he has more later data, so more than 6 out of 10, so I think probably 7 out of 10. How does the world of business play a part, to just say, get their employees, get the workforce exercising, and where can we get that financial incentives and make the business case for it?
Yeah, thanks for that question. So businesses have choices, yes, like everybody else. But their number one priority is profit, correct? So a classic example of the stakeholder versus shareholders, okay? The business of business is business, yes? Yep. Is money. How they get it is irrelevant because they want profits, the bottom line. Versus the stakeholders, starting with the employees, the communities, society, and so on and so forth. Yes? And so they have a choice. So they can make profits, but not by ignoring the others, including the health. And so they can make money. Okay? And they have a choice. And that's where the whole corporate social responsibility argument comes in business. That corporates have a responsibility towards communities, societies. That includes the well-being, physical and mental, of everyone who are using or not using their products and services. And so the choice is with corporates. To what extent then are they making use or choosing one over the other? Because you cannot compromise on profit. So how can you become richer and increase the value or the return on investment of your investors versus the vast majority of people? And America is a classic example, as you say. The richest country in the world would be continuing to do so, I believe, till our lifetime. And so the question I put back to both the panelists, Michael as well as Richard, to say, do you have a solution?
So an interesting fact is that the United States are spending more on healthcare than almost any other country on the planet, and yet achieve horrendous health outcomes for their population. So there's a huge disconnect between how much money the government spends or the healthcare system spends, filtrates, and the actual health of the individual, of the population. So that's important. So because I think we can find solutions, and India could be one of those countries where you do not have to invest the amounts of money that the United States are investing and get horrendous outcomes, basically, as you just said. So to give you, I'm a clinician, so to give you a few more numbers, after 45 in the US, more than 50% of the population are at least 2 prescription drugs. By the time they're 60, they're on 4 prescription drugs. That gives you an idea of the business side and of my colleagues' work in the United States. So it's a drug society with very poor health outcomes. There's a disconnect between the money that the government is spending, the healthcare system, and health outcomes. Maybe that's just an interesting point. And
picking up your point about you're in the wealth business, we are in the health business. Many of you have heard the phrase, health is the new wealth. And this ranges from the political situation all the way through to the commercial and the corporate wealth. Politically, in the UK, we have the National Health Service. Always comes top of the agenda for political decisions. Even Brexit was based on we would be saving the NHS so much millions if we left the European Union, which was a lie. But it is not a lie that if we take a strategy to prevent the onset of aging-related conditions, we will be saving the NHS billions and many other global healthcare systems. It's not rocket science, as Michael says. It's a change in mindset. And the change in mindset starts through education at kindergarten level. I talked about cultural background and so on. Very important that we need to change this mindset towards what is a healthy lifestyle. Workplace well-being as well. We spend most of our lives at work. Are we stressed? Are we anxious? Are we well? corporate responsibility to take care of the workforce, increasing productivity, which also increases wealth of the company. So you can see, wide-ranging. It doesn't need to be expensive to implement. It's just education. And it's a change in mindset. So I had a very good conversation, as you heard, with Professor Rai last night. You train people for mountaineering. Is that right? So mountaineering, climbing the Himalayas. But for us at ground level, we have our own mountains to climb. The mountain is becoming more physically active. It's not a mountain, but in our mind it is. So it's a change in mindset that we need to promote. It's the nudges, the social responsibility of the consumer goods companies. We talked about supermarkets this morning. Instead of promoting their brand, they can very easily and cheaply promote this consciousness of well-being at the supermarket level.
Yes, absolutely. Obviously, agree. When we talk about, and just want to go back to what you said, when we talk about chronic diseases and the elephant in the room, why are we seeing this reduction in life expectancy? Why are healthcare systems falling apart? And it's chronic diseases. It's not accidents, it's not exotic cancers, rare cancers, it's chronic diseases. And that's a cluster of diseases. So that's cardiovascular diseases, heart attack, stroke, type 2 diabetes, so late onset diabetes, and it's certain forms of cancer, which is prostate cancer, colon cancer, and breast cancer in women. So that cluster makes up about, depending on the country, 60 to 80% of the costs in a healthcare system. So and that's exactly, it's mind-boggling. So when we talk about prevention, we're talking about prevention of chronic diseases. That's the elephant in the room. That would really make a difference. And the almost absurd thing is that these diseases are largely preventable. Type 2 diabetes studies show 80%, 90% maybe, if you're very optimistic, cancer 40%, cardiovascular diseases between 40 and 60%. Depending on the population. So these are significant numbers. We can prevent diseases, and we can prevent those diseases that are really causing problems. So we're talking about these diseases, as you said, chronic diseases, NCDs, non-communicable diseases, and they're largely preventable. So there is something we can do.
So Dr. Sang, I just want to go back to the business case for this, right? You mentioned United States of America spends way more than all of the rest of the world combined. $3.7 trillion was last year's, 2023's Uncle Sam's healthcare bill. It's going to be $7 trillion by 2030. That's the economy of India and Japan put together, all right? Now let's just say that's the richest country in the world. Look at India last year. $80 billion on the healthcare bill, but only $10 billion worth of premiums collected, which meant $70 billion Indians spent out of pocket for the healthcare, right? Families go into poverty, right? Because somebody in the family becomes sick, gets prostate cancer, breast cancer, colon cancer, heart attack, stroke, right? So the business case, going back to the last word, society, where do governments and policymakers come in, Professor Vijay?
Equal responsibility. We did research during the pandemic and found out that it's no longer only corporate social responsibility or government social responsibility. It's everybody's responsibility. It starts from home. It's the parents' responsibility, it's the children's responsibility, it's the teacher's responsibility, the school's responsibility. It starts and then it escalates. It's everybody's responsibility. Every single stakeholder who lives on earth is responsible for the well-being of themselves first. As they say, if you go in an aircraft, they say, if there is a problem, you first put the mask yourself, then you help others. It's my responsibility for my health. If I am not healthy, I cannot keep my family healthy. And I think it goes back to answering your question to say, to what extent are we, whether we're academics or people working in the health sector or governments or businesses, to what extent are we educating the masses? So I think education on health issues is the basic grassroots necessity to eradicate it and make it a better world in the future.
Yeah. Can I pick up the very important concept of policy and legislation? We have just emerged from COVID. There was much policy and legislation around prevention of people spreading COVID, picking up COVID, and so on. And that was to reduce healthcare costs, ultimately. We're talking last night, you were locked up in your apartment for 6 months. That was the law. You had to do that. We had to take lateral flow tests. That was the law, legislation, change in policy overnight, because there's an urgent need. Governments do not see the urgent need and the economic burden of this chronic diseases over the next, don't have to say 30 years, over the next year even, you know, how much they can save through implementing small changes in policy, legislation, through educating the policymakers as well. Okay, we have taxes now on cigarettes, we have taxes on high sugar drinks and so on. We also have fortification of certain foods. All of this is legislation. But how can we bring this into prevention of chronic diseases? What is the financial incentive for the governments? It's obvious. For the corporates, it's obvious. But it needs a change in mindset. We need to educate them so that, you know, it's all about winning votes with the politicians. And maybe this is an important time. There's voting, there's politics happening everywhere, here in France, in the States, and so on. The health agenda needs to be at the grassroots level.
Okay, can you tax someone for not exercising? I think that'll create some. Okay, we'll open it up for questions for the audience. I mean, Dr. Sagner and Professor Sia and Vijay, take them. Yes.
Hello. Thank you. My name is Kumar Bagrodia. I'm an applied neuroscientist. I'd like to wholeheartedly congratulate Dr. Richard Xiao and Michael for those comments. I think it's for far too long. Every healthcare or health-related discussion, and I've come from India, where we start beating down the fact that we don't have enough funding or money in the healthcare system. I think the problem is too much money and vested interests. And both of you have just highlighted that. You know, there was an interesting research done last year by the Time magazine that there has been more money spent on mental health in the US than all other countries put together. And the US is the most drugged country on the planet in terms of mental health, anxiety, depression, ADHD, etc. When you look at India, it is the same vested interests, so big pharma, psychiatry, psychology, med tech, which are saying, hey, we don't have enough psychiatrists per capita in India. Look at the West. Well, we don't need that many psychiatrists because then you have more channel partners for big pharma to drug the rest of the population, right? So I agree with you that there has to be a mindset change, but how do we work with the powers that be? And the powers that be is no longer the governments, it's the people who are writing the big checks, who are the people who are legislating or pushing for legislation for bigger budgets to be spent on medication rather than on the mindset change, lifestyle change.
Thank you, Kumar. I think India has to learn from the mistakes that the US and the European Union have made over the last 40 years. We have tried to educate people. We have tried with sometimes weak legislation, taxing things. We've tried to change lifestyles. It hasn't really worked. Obesity rates are going up, chronic disease rates are going up. As you said, we're spending more and more money, we're dumping more and more money into the system with absolutely no net positive result. And the US are the prime example. And you could add another trillion, it would not get any better, it would probably get worse. So I think it's very important to look at what we've been trying to do in the European Union, in the UK, in the US, and not make the same mistakes again. And we have been making a lot of mistakes. And education is very important, I agree, but it has to go beyond that. It has to go beyond that. because we've been trying that. School, education. I was part of the European Union Health Commission in 2015, teaching children how to cook, teaching children about physical activity. It didn't change anything. And then we stopped doing it. And then we invited brilliant marketing geniuses, Rory Sutherland, and others, to nudge people into healthier lifestyles. Didn't do anything. I think we have to be really smart, and maybe it's technologies that make it easier. It's very, very important not to make the same mistakes again. We have to learn from the mistakes, and especially India with all its great potential.
Let me pick that up. Certainly, we need to learn from our mistakes, but also we need to learn from case studies. And I just want to very quickly highlight two. One is from my time that I spent in Bangalore with Unilever, and I learned a lot. So Unilever Consumer Goods. I learned a lot about their marketing psychology, but also about social responsibility. In India, it's the only country where they provide water filtration devices to rural communities, almost for free. That enables the communities to have clean water so that they can buy the Unilever soap, buy the Unilever food compounds and so on at a very cheap level. But when you do this across, over 1 billion people, then you can see the economies of scale and so on. But you're making a difference to the community. So that's a good case study. They prevented many diseases in young children because of clean water. The second case study is empowering, again, through a consumer goods company, how you can use a digital platform that could be called Activo Labs through a biscuit company called Britannia that many of you have heard about. They sell biscuits, but they are also enabling the individual, free of charge, to have greater awareness of their own health. Digital platforms. You don't have access to healthcare, but everyone has access to a mobile phone, a digital device, where they can download the app for free and be aware, more aware of their own health. And finally, because we're running out of time, we've not really mentioned the impact of sports in societies. We know all about it from this morning, but you are reaching, we as a community, reaching so many through the passion for sports. It's not only becoming more physically active, but the responsibility of us in the media field, for example, using the passion for sports, the culture, the ingrained culture of sports in our societies. How can we harness that to improve, to educate, to prevent these chronic diseases?
All right, I think we are out of time, but that was fantastic. I could keep on listening to both of you, but thank you.
You can carry forward these conversations during lunch.
Yeah. Okay. During lunch? Okay, thanks, Gloria. All right, thank you so much, guys, and thank you, Professor Vijay, Dr. Sagna, Professor Seo. Thank you so much. Thank you.